News at 6.
Good evening. Thanks for joining us. I'm Erica Thomas.
And I'm Darren Bob. Hospitals all across the area seeing a lot of patients being admitted with respiratory illnesses like COVID and the flu.
5 News reporter Catherine Gilker tells us what's contributing to this increase and what you can do to protect yourself.
Sickness is often the aftermath of the holiday season with lots of gatherings the last 2 months. And because of this, hospitals are seeing quite the increase. Mercy Hospital Northwest and Fort Smith both continue to see a high number of patients with respiratory illnesses, so many that they are currently at ICU capacity. And Washington Regional is also seeing a high number of patients, with many who need intensive care. But they say they are seeing the number of people admitted with the flu beginning to drop. But the number of patients being admitted with COVID continues to slowly climb.
Right now, that is predominantly COVID-19 and influenza. We had an earlier start to the flu season than previous pre-pandemic seasons. That has thankfully slowed a bit, but is still quite high.
Dr. Mike Sema says COVID-19 cases have been increasing since the Thanksgiving holiday, and both flu and COVID are contributing to the rise in hospitalizations. He says even though 405 hospitalizations statewide may sound high, hospitalizations got up to more than 1,500 this time last year with the Omicron surge. He says the best way to protect yourself is getting the updated vaccine.
When I'm talking about being up to date on your vaccinations right now, that means having received your updated bivalent booster. That is more well paired with the variants that are spreading around the state and have been spreading around the state since the fall.
According to Dr. Sema, the newest COVID variant is rapidly gaining ground across the nation, and it's expected to soon be the dominant variant.
Appears to be the most transmissible and the most immune-evasive, building on each variant that has come before it, all sublineages of Omicron. What we don't know at this point definitively is if it causes more severe disease. Right now, there's no evidence to suggest that it does cause more severe disease, but our knowledge about this variant is evolving, and the data are scarce.
Covering news where you live, Catherine Gilker, 5 News.
The Arkansas Department of Health says if you feel sick, just stay home and get tested. If you are positive, stay home until you're recovered. Now, an urgent care or your family doctor can also prescribe medicines that can ease your symptoms. Meanwhile,